no father or son.
Truly He is the one, He has no father or son.
Everything in creation was by Him begun.
Everything in creation was by Him begun.
With His infinite power, anything could be done.
With His infinite power, anything could be done.
Ask Allah for His pardon,
Ask Allah for His pardon,
and you'll enter the garden.
الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد صلى الله عليه وسلم وعلى آله وصحبه أجمعين. السلام عليكم ورحمة الله وبركاته. So Alhamdulillah Rabbil Alameen, we've had a lot of lectures already today, and mine will actually be complementing some of the things that we have already listened to. So even though I have like up to 100 slides, but many of these slides have been talked about. So Alhamdulillah that is happening. So, but for the objective of what I want to talk about, which is dealing with chronic diseases, where hypertension, diabetes, and chronic kidney disease is our focus for the day. Because when you talk about chronic diseases, they are more or less like uncountable. But we want to limit ourselves to these three because they are very, very common. So we want to go by this objective. At the end of the day, we should be able to understand, how to manage or prevent hypertension, diabetes, and kidney disease. Also address the challenges and the complications that can come from these chronic diseases, and practical steps, lifestyle changes, especially in the area of prevention, because prevention is actually better than cure. Okay, so normally, what do we want? Definitely, everybody wants long life. If you can live up to like 120 years or 150, that's not bad. Of course, we want to be young forever, even though we are old, but we want to be agile. No disease, no sickness. We don't want we want to have a lot of stamina, happiness, and a lot of money. I know quite a number of us, we want money. But upon all, as Muslims, we want the rahmah of Allah. We want Al-Jannah Firdaus. May Allah subhanahu wa ta'ala make this a lot for every one of us. But the reality, what's the reality? The reality is that average lifespan is about 70 to 75 years, even in developed countries. Unfortunately for us in Nigeria, they said 45. So anybody above 45 now, maybe you are using extra time. And a lot of diseases. Okay, so Imam has alluded to this because we have both communicable, meaning infectious diseases, and non-communicable, which are one of the chronic diseases that we want to talk about today. Why do we have all of this? Because Allah has designed the world to be like that. Allah says in the Quran, He has created us in continuous struggle. So, while the reality is that we don't want to have any of these things, that is our wants, but the reality is that they exist. The only thing is that how do we manage them? How do we prevent some of them, and how do we still have a meaningful life, even with some of these diseases happening? So I won't need to bother ourselves about the WHO definition of health. Imam has really done justice to this. And why do we seek for good health? Imam has also mentioned a lot about this. But I want to also emphasize, especially the issue of fulfilling our religious obligations. Allah subhanahu wa ta'ala says, وَمَا خَلَقَتُ الْجِنَّ وَالْإِنسَ إِلَّا لِيَعْبُدُونَ. The reason why He created us is for us to worship Him. And if we are to worship Allah truly, then we have to be healthy in order to be able to worship Allah very well. So, and a lot of hadiths of the Prophet ﷺ showing that we must seek for good health. It is compulsory. Because anything that is compulsory in Islam, if worshiping Allah is compulsory, everything that will make that to be easily done is also compulsory. We can't perform salat. If salat is compulsory, then ablution is compulsory, because without ablution there is no salat. So without being in good health, you're not able to serve Allah well. So it's compulsory for every Muslim, to seek for good health. And that is why you see a lot of hadiths of Prophet mentioning, about good health. One of it, Prophet said that Allah has given mankind at least 2 ni'mah, blessings. But a lot of people are usually very negligent of them. One of them is health, good health. So that's why when Imam said we should thank Allah subhanahu wa ta'ala if we have good health, we should not be negligent. Wọ́n ní kí ẹni tó bá lálàáfíà kó má lọ wá fíafíà káàkiri. A lot of us we have àlàáfíà fíafíà là ń wá. So I think that is one of the importance of this. So we are in the month of Ramadan. Apart from a lot of spiritual benefits that Ramadan has come to give us, we know this. But there is also, these are evidence-based, benefit of Ramadan. Okay, in terms of health benefit, improving of our digestive system. Because during the month of Ramadan, we rest the digestive system. So it's like it is renewed. And many of the diseases that are associated with the digestive system are lesser in Muslims that do fast Ramadan, evidence-based. Okay? It has also been shown that weight reduction, okay? And we know a lot of problem that is associated with obesity. What about better blood pressure control? What about blood sugar control? And these are the things we want to talk about today. Detoxification. And of course, emotional well-being. All of these things are what we know about the benefits of Ramadan. So let's now go to the topic of the day, hypertension. So, hypertension is the most common cardiovascular disease all over the world. So when you're talking about the disease that has to do with the heart and the blood vessels, hypertension is the most common. In fact, it is said that as many as 30% to 35% of Nigerians are hypertensive. And we can check here. If we bring blood pressure machine and we start checking people's, I will not be surprised to see, maybe if we are 100 here, we may see about 10 or 20 that have elevated blood pressure. It affects all race and gender. It's no respecter of any. And of course, it's increasing also globally. It's said to be affecting about 1.3 billion of people. So that's almost like 1/5 of the world population. And 1 in every 5 individuals is at risk of hypertension in his lifetime. So it's as that common. Dr. M.Y.M. Habib discussed cancer. Cancer is increasing, but not as common as hypertension. Not as common as diabetes. And unfortunately, because the two, they are like denominators for other diseases, like chronic kidney disease. They are also in the increase. And that is why we have brought these 3 conditions, because they have a lot of things in common, especially their causes. So there's what we call the rule of third. Alright? The rule of third is that hypertension is very common. But we do not know that they are as that common because we are not checking for them. It has been said that 1/3 is only 1/3 of all the people that are hypertensive that are aware about it. Meaning that 30% of people who are hypertensive actually know. Among these 1/3 is only 1/3 of those ones that are doing anything about it. And these are very manifest in our clinic. When we see patients, they are coming to us and we check their blood pressure is high. And we say, Daddy, Mommy, your blood pressure is high. Is it the first time that you are checking it? Mommy, they checked this for me one time like that, but they say it has gone. Meaning, the person is aware, he's not doing anything about it. And now he's coming to clinic with blood pressure of 170/100, which is high. So meaning that, and then Even those who are doing something about it, maybe they're coming to clinic, how many of them are treated to target? Target means that at any given point in time, our blood pressure should not go more than 140/90. That is the target. So even if you are hypertensive, you are using medication, you go to clinic, and your blood pressure is still higher than this value, then there is problem. Because what that means is that complication of hypertension can still occur even in individuals that are doing something because they are not doing enough in order to maintain it to target. So I won't bother us with this. This is WHO classification, but we should know that hypertension too has grade. There is one that is mild, moderate, and severe. Okay? These things that I'm talking about, they are not abstract. They are things that are within us, except we are not checking. I happened to have a patient in my clinic one day. A young man, about 35 years of age, he came to GOPD, that General Outpatient Department. So for something that looked like tiredness, they were thinking malaria. So they checked the blood pressure, which is routine. You check the vital signs. And the nurses found that the blood pressure was extremely high. They said they got what we call systolic is the upper part. Okay? That they got 280 systolic. And diastolic was 180. They've never seen something like that. Say, this young man, and the man said, why are you troubling me? I came for malaria drug. Just give me malaria and let me go. They said, no, you are not going anywhere. We are admitting you. He was just laughing and, looking at them that they are saying something. So they brought the person from GOPD to my own clinic. No, you have to see specialists. We have not seen your type. So they brought the patient. I was seeing another patient. I said they should be patient. That they should allow him to rest. So I was also thinking that maybe they didn't do it well. Because 280 over 180 diastolic. That is extreme. So, but that day I saw something that I've never seen in my life. And maybe after that time I've not seen something like that. So I allowed the young man to rest. And then now ask them to bring mercury in glass sphygmomanometer. Because I was thinking that maybe because of the one they used. But to my own surprise, when I started inflating this machine that we normally use, the upper part of that machine is 300. And this man, when I was inflating, it's actually beyond, because I can hear the conductor even when it has gone beyond. Meaning the blood pressure is actually more than 300. Yet it just came. Because the 300 is the maximum. And the diastolic was about 210. This is somebody who came to general outpatient. They said, have you done it before? He said, no, that he's never been sick in his life. So everybody said, no, you are not going home. I said, no, you can't go home. Because it's a time bomb. And that's why you see people on the road, they will be fighting conductor. And he will just slum, he die. You don't know, maybe the blood pressure is already because the cerebral blood vessels, the one that's supplying our brain, at that pressure, any small thing, it will burst. And if the person will leak the entire blood, because of the pressure into the brain. Such person will not get to the hospital now. He's on the spot. So, that is the kind of thing. Of course, the remaining part of the story maybe for another time. I won't tell us what happened to the man. He refused admission. The first thing is that he refused admission. He said, that even after that, he didn't feel anything. Now, why should they coerce him to come for admission and all of that? But they brought him back with stroke. No, they brought him back with stroke. So, and he died. Eventually, after a lot of. I didn't want to. It was a very bad experience. I've never seen anything like that after that. But these are things that is not written on the face, especially hypertension. So when we talk about what are the risk factors, good thing about my topic now is that the risk factors, they are like denominator. So if I mention it about hypertension, it's the same thing for diabetes and all of that. So I may not need to stretch that too much. Age. Now, the risk factors are usually divided into two. to make it easier for us. We say modifiable risk factor and non-modifiable. Meaning that the one we can really do something about and the one we may not be able to do much about them. For instance, age. What can we do about our age? And it has been shown that the older we become, the more tendency for hypertension, diabetes, chronic kidney, one of these, the osteoarthritis, even cancer, has been mentioned there, that they are directly proportional related to the age. So we may not be able to do much about that. Gender. They said men that will have more hypertension in terms of head-to-head comparison than the women, provided the women are still within the reproductive age. So postmenopausal women and men, they are the same. But if before that time, because it has been said that estrogen is a bit protective for women. So as regards hypertension, of course, family history, we've talked about genetics, some of them run in the family, and the whole of that. Now, modifiable risk factor, and that is the one I'm going to stress later. But many of them are things that Dr. MIB a bit mentioned about diet, especially diet. Okay, salt diet, sugar, fat, diet. In fact, especially sodium. So sodium and its sisters and cousins and all of that. Because when you say sodium chloride is sodium. Sodium monoglutamate is sodium. The one that you have in Ajinomoto and all of that, and they say they're all sodium. Okay? So, because they are component of sodium. So you can see, these are the modifiable risk factor. Now, obesity, that's, excessive fat. Physical inactivity. In fact, I wanted to mention that. But luckily that Asolat came and we went to pray Asolat. A lot of us have been sitting down here for almost 3 hours listening to lecture. We did not get up. That's part of inactivity. We did not even go and use the restroom. No, we must be getting up after sitting down for like 1 hour, maximum 1.5 hours. Get up, stretch your leg, go, then come back. It starts with that. But when we are comfortable sitting down, that's why we will not know that we are accumulating fat instead of burning them. So, high cholesterol diet, smoking, alcohol. Dr. MIB mentioned a lot of all these things. Lack of eating fruit. It's only in Ramadan that we eat fruit. As if Allah created Ramadan and fruit together. Somebody who have not eaten, they will never buy excess. Well, alhamdulillah for Ramadan, sha. Now, I mentioned age for us to know. Those of us that we are now more than 60 years. Sorry. No. Most of us that we are now more than 60 years of age, it has been said that at least about 65% of us will be hypertensive. So it's directly proportional. And of course, the prevalence is actually lower in younger age groups. So that is what this. Now, you see, when we talk about obesity, it's a combination of two things: excessive eating and lack of exercise. So, and if you want to curb obesity, you have to do the two. You eat less and you exercise more. Because you have to burn whatever you have taken. So, let us continue to eat. And of course, unhealthy lifestyle, smoking, and a lot of things that are being sold at the junctions. Junctions, yes. Look at this. Balaga. Okay, this is, in where we were, Bagada area, what do you call it? Where my hospital is. They said something like this. So, where is the thing now? That's gone. Baraga. You can see, they are there. When they come in the morning, that is what they will use to brush mouth and all of that. All the motor parts people. And we say hypertension is increasing, diabetes is increasing, cancer is increasing, kidney disease is increasing. These are the reasons for them. And unfortunately, our government are not helping the matter. Because they allow this thing to feather. They haven't done them in small, they are all alcoholic based. It's around. But that is what is all over. I'm sorry. I'm sure you won't have this in Lekki, I'm sure. So what are the complications of hypertension? heart attack, stroke, kidney failure, heart failure. There are more. I've only mentioned these few ones. Even blindness, retinopathy, hypertension causes it. Unfortunately, many patients are like that patient that I mentioned. Meaning that because it doesn't give signs and symptoms, they do not know. So the first time we know that somebody has hypertension is when the complication has come. It is too late. When I begin to talk about prevention, there are 4 types of prevention. I will mention them. Even before we give birth to our baby, we should start to prevent them from getting hypertension, from getting diabetes, from getting chronic kidney. It's possible. What we do will eventually affect the unborn baby. All right, so fortunately, Dr. M.I.M. Habib cancer, they are expensive people to diagnose. But hypertension is the number one in terms of the easiest to diagnose, and it's not expensive. Because what it takes is that machine that we see here. Okay? It's unfortunate that nobody is selling that machine here. Maybe next time you call me, I will bring the machine to come and sell. I won't give us free now, but all of us will buy one of this one, we will take it to. It's cheap. Maybe 15,000. And you can buy one for the whole family. Okay? So, what I mean is that just check the blood pressure. If it's persistently higher than 140/90, because that is WHO classification for hypertension, or more than 2 occasions, at least about 2 or 3 weeks apart, then it's hypertension. I know our Christian counterpart will say, God forbid or something like that, but we have already seen now, except we don't want to grow old. They said the thing, it's about age, it's about this. So, having blood pressure or hypertension is not the problem, even if eventually comes. But what do we do about it? How do we handle them? Alright? So, all the other investigation, like doing urine tests, these are very simple things. Blood test, X-ray, ECG, echo, that we can do. They are to now check if there are complications or not. We don't even need them to make diagnosis. But is that complication or is that no complication? So that we can manage it holistically. So when we want to manage, there is what we call drug treatment and non-drug treatment. Because we have a lot of modifiable risk factors, that takes precedence. It takes even better than drug. Because if we can do that, okay, look at it. They said if you control your diet, which Allah subhanahu wa ta'ala has already said we should control, you are going to bring the blood pressure down by 8 to 14 millimeter of mercury. Dietary control alone. If you now add that to every 10 kilogram weight reduction, you are going to bring it down from between 5 to 20 millimeter of mercury with just weight reduction. Now combine it with salt, if you do all of that, you have already controlled the blood pressure now. Even before medication. So that is why some of these things are important. So, but hypertension has some misconception. Number one is that we think that if we are young, we cannot be hypertensive. No, that is not correct. Although I have said that it is, more common in older age group, but young people, because that's what we also call secondary type of hypertension. Hypertension can be primary or secondary. I don't want to really bother us much, but there are some that are secondary, and even in a newborn, they can be hypertensive. That is not common, all right? It's not common, but it's possible. Some people say, I don't have blood pressure. I don't think now. I don't think anything. I don't sleep, I wake. I don't even have problem sleeping. And the blood pressure of the person is 190/120. Because thinking is not the only cause of hypertension. If I think it doesn't cause hypertension, is there anybody that doesn't think? But if you say you are worried, anxiety, because the catecholamines and all of that will come and can act or trigger the other factors that we have already said. Those other factors must have been there. But your anxiety, continuous anxiety, can now trigger it. And maybe that is the one that is making that man's blood pressure to be like that. Allah Alam. Well, is it curable? For now, we don't have a singular cure for it. But see, Allah subhanahu wa ta'ala has already said there is no disease that without a cure. We may not know them for now. But what we have for now is sufficient for us, at least if we do that. Because there are a lot of drugs that can be used to control it. If the lifestyle modification alone is not able to control the blood pressure. So, we can use drug. Then, if somebody is eventually on hypertensive drug, how long is he going to use the medicine? Because that is the problem. When I see patient, I say, it is time for you to be on medication. I will not be using it forever. Well, so be it. It's a chronic disease. The blood vessels are already atrophied. Those ones who are not reversible, we are aging. Can we bring down our age? And so we have to use them. And the reason is because we want to prevent complication. Okay, so hypertension and Ramadan. Well, unfortunately, Ramadan is almost half. We should have had this one before Ramadan, because the first thing is that can a hypertensive patient observe fasting? Of course, the answer is, what is your grade of hypertension? So you have to first of all go and know, is it a mild or is it a moderate, is it a severe form? If it is the kind of 300 and 200, the person will be in the hospital. He will definitely be in the hospital. He will be pumping him with serious, because we don't want him to have stroke that he eventually had. So that grade of hypertension, no, cannot. But if it is the one that is moderate, or that is somebody is already using hypertensive, why not? We feel fat. After all, it doesn't even give any signs and symptoms. So what about medication schedule? And that is why I said this maybe should have come. Anybody that is hypertensive and wants to fast from Ramadan should supposed to go and see his doctor. Muslim doctor for that matter, because if you go and meet Kufar that does not want you to fast, he will say, why are you fasting? Maybe you have hypertension. But mild, moderate hypertension, control hypertension in fact, like we said, your blood pressure will be better during fasting. So it's a benefit. But they will want to discourage you. But you have to go and meet a Muslim doctor that also understands Islam. They will help you schedule your drug. Okay, we are on three daily drug. We can schedule them to 2 times a day. There are even some drugs we can make them what we call fixed dose combination. All the 3 drugs in one, just taking one a day and you are fine. Okay, whether it's iftar or it's Zawud that you take your drug, and that is all. So, but that's why I said many of these, needed to have. But it's not too late. Ramadan is still there. So let me quickly talk about diabetes. It's a disease of chronic hyperglycemia. Now, what that means is that the pancreas, which is an organ that is secreting insulin. Insulin is an hormone in our body that is helping us to regulate our blood sugar. So when that insulin has problem, meaning that it is not produced in a sufficient quantity, or it's not working the way it should work, the blood sugar will not be controlled. So there will be chronic hyperglycemia, meaning blood sugar will increase. And if you look at this, I don't know whether we see it. They said the prevalence of it is also increasing, and that is why you see that graph. Okay? Worldwide, approximately about 10% of what population has hypertension, diabetes. So it's also very, very common. And in Nigeria, it's about 5.7%. So, and it's increasing, like we have it in blood pressure. 80% of these deaths from diabetes occur in low and middle income country. Okay? Because majority will not even take care of it. And when they now have complication, because it's the complication that usually kill, not the blood sugar itself. So, many do not have the wherewithal to take care of it. Now, we have majorly 4 types of diabetes, or yes. So there's what we call type 1, there is type 2, there is gestational diabetes, and there is intermediate. Okay? Type 1 diabetes, we used to call it non-insulin dependent diabetic mellitus. Okay? Meaning that, the type 1 used to be called insulin dependent diabetic mellitus. That is type 1. Meaning that such individual, they will have to depend on the insulin. Insulin is what is lacking. So we have to use a synthetic insulin to be controlling the blood pressure because the person doesn't have. The other one is non-insulin dependent, which is not the type 2. Alright? And that is the one that is more common, okay, among individuals. Type 1, usually the young individual, they can't do without using insulin. And that is why you see that they must have been giving themselves insulin right from very young age group. Some from age of 5, that have been diagnosed to have type 1, diabetes. And they have to be on that insulin for life. Alright? So, and then there's gestational diabetes, the one that occur during pregnancy. So, pregnancy is also one of the causes of diabetes. Okay, so I won't need to go to this. I've already explained them. And then the causes. Genetics, that is, familiar tendencies, environmental, diet, obesity, inactivity, pregnancy, I've mentioned it. Alright? The risk factor. Almost all the risk factors for high blood pressure are the risk factors because they are even interwoven. There is a disease, there is a condition we call syndrome X. It's a combination of hypertension, diabetes, obesity. We call it metabolic syndrome. They always go together. When somebody is hypertensive, watch that person very well. Over time, he may be diabetic. If somebody is diabetic, continue to watch. Over time, the person may be hypertensive because these things, they come together. And like I said, sedentary lifestyle, almost all the risk factors are like common denominators. So once you are able to prevent one, you will be in a way preventing the others as well. So unlike hypertension, should I say good thing or bad thing as regards diabetes? Hypertension has no specific signs and symptoms. That's why it's very bad. Because it's not giving anybody any warning. So like that man, if he has had symptoms that say, I'm having that, somebody will have even call his attention that you need to go and see a doctor. But diabetes, good, it has, symptoms. So by the time somebody started to drink water a lot, whether the weather is cold or hot, he said, I'm just feeling thirsty everywhere. So we call it polydipsia, excessive drinking, excessive thirst. That is one of the signs. When somebody started urinating a lot, this one is different from just frequency, but large volume urine, meaning that each time the person goes to urinate, he will urinate a lot, and he's doing that frequently. That is polyuria, meaning that excessive urination. And that individual will also be eating a lot. We call it polyphagia. So the tetrad of diabetes, there are 4. And that is why I put them together. There are other signs. Sometimes are eating, but these 4, they are not eating. The person will be urinating a lot, he will be drinking a lot, and he will be eating a lot. At the same time, he will be losing weight. Bó ṣe ń jẹ ló máa rù. Kò bára jẹ. Diabetes, That is diabetes. It's easy. And the reason is not far-fetched. The blood sugar, the excess glucose, causes osmotic diuresis. Because it's so concentrated that it will irritate the bladder. Then you want to pass urine. And it will draw water from all the other parts of the body in order to pass it out. So, and immediately that is done. Because the way Allah has created human is that our brain controls everything. It's like a sensor. Then the brain will now sense that there is less water in the body because the person has urinated them too much. So it will now have the urge that will trigger the test center in the brain that no, you need to rehydrate. So it will now drink. The more you drink, the more you will pass the urine. And then because the glucose that is supposed to be useful inside the cell, these blood sugars are not supposed to be in the blood. Even when they are in the blood, they are supposed to be within a particular range. But there are excess in the blood. So we call them hyperglycemia. Where we need this, the glucose is within our cells, but that is where they will be utilized for normal body function, the brain and all of that. But they are not there. So the cells are actually starved. They don't have glucose. Whereas the blood is just there, useless. So we call it a disease of plenty in the midst of, a disease of plenty in the midst of, So you are suffering. Whereas the glucose are there, not useful. So the person will also be feeling hungry. Because the body will say, there's no glucose. The brain will say there's no glucose. So you will begin to eat more. But when you eat, because it's not going to where it's supposed to go, you'll be losing weight. So that is the there are other signs and symptoms. Maybe I need to just mention some of them. Sometimes we say we are not seeing very well. It may be diabetes. A lot of our diabetes patients are diagnosed at eye clinic. They went for eye test. They say, no, this is diabetes. It is not from the eye. Tingling sensation. Some people, they will just say, it's diabetes most of the time because that is neuropathy. Some people, when they are giving birth to baby, the baby will be big. We call it microsomia. Maybe that is what we will see, And sometimes it may not also give any sign and symptom. But in 90% of cases, unlike hypertension doesn't have any specific sign or symptoms. In fact, it doesn't give any sign. But diabetes does, and maybe we can call it an advantage. Now, complications. We have acute and chronic complications. For acute complication, when the blood sugar is so high, just like the blood pressure is so high, the person will land into the hospital, there's no way. He will be unconscious. We call it ketoacidosis or coma. That is it. Quite a number of them, when they come to emergency, we use that strip, glucometer, to check. And it would say high, unrecordably high. Just like that person has unrecordably high blood pressure, meaning that what it just scale, anything above 600, the machine say, I can't read it. It's too much. So you just say high, danger, meaning it's more than 600 milligrams per day. So if that person doesn't get immediate treatment, he will die. Now, the opposite of it is hypoglycemia. So people who are also diabetics, and that is why diabetes and Ramadan, we need to also look at that. Anybody who is diabetic and is fasting Ramadan, he has to be careful of hypoglycemia because the blood sugar can also go too low. And that is why all of this is. So these are chronic complications. Diabetic retinopathy is one of the commonest causes of blindness. Glaucoma is diabetes. Diabetic foot syndrome. Apart from Okada, alhamdulillah that they have banned Okada in many parts of Lagos now, because that is the one that is usually causing amputation. When there is road traffic accident from Okada. But diabetes worldwide is the most common cause of amputation, because when they have diabetic foot syndrome, they have to amputate, and people that don't usually accept that amputation, they die. All the patients that I've seen all of them that refused amputation, they died. No, they will die. Infection will enter, and then when infection enter, all these things, they are bad experiences. So I don't want to be saying them. A patient came, he was just the toe of the foot that was gangrenous. They offered to amputate the toe. He said no. He went. By the time he comes back, they have to bring him back. It has gotten to the knee. So it has spread, because it will be gangrene, it will be spreading up. They now say, okay, they can't cut it below the knee again, because the infection has spread. So it has to be above the knee. Yes. He said, no, that above the knee, what will he be doing? He went away. By the time he came, it has already reached here. Where are they going to cut? So the surgeon said, well, it's inoperable. They just did palliative, of course, he died. So most of the patients, they can't, and of course, there are skin problems as a result of diabetes, teeth problem, and so on and so forth. Diabetes is also easy to diagnose. If I had known, I would have brought at least glucometer here. So we can check. This thing we may never know unless we check. That's the problem. Okay? Fortunately, many of these things, if we check, there's a way we will interpret it. FBS means fasting blood sugar. That means if we have not eaten. Okay? If we have, like we are fasting now, I mean Ramadan. So we are at 3 p.m. If we do the test now, it will be almost like equivalent to what the fasting will be. Because we are talking about fasting normally from night and the morning. So if you do it, we can interpret it that way. And if somebody has eaten, how long has he eaten? We can interpret it to know whether that person is diabetic or not. And there are grades. So this is WHO diagnostic criteria. I'm not going to bother also. But when we see it, we say, this is your grade. 7 and above is diabetic. Or hemoglobin A1C, 6.5% and above is diabetes. So if we see it, we will make diagnosis. So it's not difficult. Other investigation we can do. How do we manage it? The goal is first of all reduce the symptoms, promote well-being, prevent complication. It's complication and onset of long-term complication. So acute complication like diabetic ketoacidosis or hypoglycemia, and then chronic complication like retinopathy, glaucoma, diabetic foot syndrome, kidney failure. Alright? Those are the chronic complications of diabetes. So, just like in hypertension, nutrition is one of the ways we manage it. Exercise, monitoring, and education. These are very key. So, I may not need to go over them again because we have already mentioned many of these, and then the drugs. One thing I want to mention, especially diabetes and diet. Carbohydrate diet. I've seen patients, when they say, okay, they are diabetes, they say, wọ́n sọ pé kí n má jẹ ẹ̀bà mọ́, wọ́n ní kí n má jẹ rice. It's only unripe banana, plantain, and the wheat. And the individual, when they come to our clinic, we check their blood sugar, it's on the roof. You know why? Because he believes that since that is what they ask him to be eating, he will now eat it in an excessive manner. You have already, rubbished the essence. The essence is quantity. The quantity. Okay. The quantity. So, gone are the days when we say, you don't eat this, don't eat this, don't eat it. No. The only thing that you cannot eat, if you are diabetic, is sugar. Or anything sugar has been added. Meaning that you can eat amala, eba, rice, semo. No, you can't. I'm telling you, it may be strange, but that is the truth. All the people that practice the opposite, they miss it. Because when you are eating those carbohydrates, it will give you your own quantity. This is my own quantity. So, if you just make your feast, that is your own quantity. So, like Ramadan has come to train us about discipline. With seafood, we will not eat it. So, ordinarily, for people who like food, and you tell them that this is an okele koni, that is one okele. Meaning that once I told this one, I say yes, that's all. So, if you are going to eat amala, eba, that is your quantity. If you do it that way, your blood sugar will be well. So you don't have to be looking for ripe plantain and all sorts of things, and then you now eat excess and you now come back with hyperglycemia. Because at the end of the day, they are all glucose that they will be broken down too. So that is the quantity. Drink a lot of water. You can eat a lot of vegetable. You can eat fruit in order so that you can. But some people that do not like food, well, maybe that is okay for them. Sorry, I took our time because I know it may be part of the question they will ask. I have just few minutes. So, what about other treatment? Of course, we have a lot of drugs. I'm not here to discuss drugs. When I mentioned hypertension, I didn't mention a single one. We have more than 100. And I can mention at least 50 from here. So it's not about drugs. We know there are plenty. Combination and individual. what is important is that when it is required drug, please let us use them. And let us comply by them. One problem that I normally see with patients is that, so I will not be on this drug. Some people say, even the drug can cause problem now. Is it true? Do you want stroke or the problem that the drug will cause? I have no patient who my own professor, when we were, luckily, Dr. M.I. but he's my senior, don't mind him, when we were in medical school. So, that our own professor, when we were in medical school, they were treating. They were young then. And they passed them to us when we became doctor. You can imagine how old. There was even one Baba, 84, 85. I was the one that said, don't let Baba be climbing because our clinic is up. Sometimes Baba will say he will come alone. I said, no, don't come alone. To still show how healthy this 84, 85 man, he want to come where our clinic. Now, what I'm saying is that he did not have any complication of the drug, and he's been using drug 40 years before we even became a doctor. So, don't tell me that the drug is too much. Tell me one person that it is the drug that killed him. If the complication is the stroke, is the heart attack, coronary disease, it is the kidney failure out of the disease that killed most of the patient, not the drug. So if we were to take medicine, let us take it. So there are plenty of them, oral, and of course insulin for the insulin dependent type. And there are many places they can give themselves insulin. Alright. Sometimes we can also, in situation where there is an autoimmune pancreatitis, there is a cause of the diabetes, we may have to transplant another person's pancreas. Okay? Maybe when I get to kidney disease. So, let me just go. There are a lot of misconceptions about diabetes again. Well, maybe when there is time, we will mention it. Let's quickly talk about chronic kidney disease. Alright, so we have two pairs of kidney and they are bean shaped. You can see they look like a bean. And they are retroperitoneal. Our kidney is here. There's one here. There's one at the back of our abdomen. They are not in the front. So don't let anybody kick you here. That is kidney. Okay? So, and they have a lot of functions. Allah created them with those functions. Alright, so they control excessive water intake, waste product removal, electrolyte, balance. Some of them are also involved in ensuring we have blood. Because erythropoietin is an hormone in the kidney that is helping our bone marrow to produce blood. And there's also vitamin D, the active vitamin D. Okay? Although the beginning of it is from the sunlight. When the sun rays touches our skin, underneath the skin, there is a cholesterol-like substance. So that one will convert it to hydrocholecalciferol. And then in the kidney, the last process takes place in the kidney to become 125 dihydrocholecalciferol. That is the active vitamin D. So you can imagine if there is a problem with the kidney, all these functions will be affected. That leads us to type. We have the acute, we have the chronic type. Kidney disease is also becoming so rampant now, and that is why you will be hearing today somebody needs millions of naira for kidney transplant, is on dialysis, is on the rise. Why? Diabetes on the rise, hypertension is on the rise. Let us look at the reason. And unfortunately, like cancer, kidney disease too is extremely expensive to treat. So prevention is better than cure. For instance, that one dialysis now, it used to be 25,000. But everything is expensive now. It's now 40,000, and the person will need 3 of it in a week. So in a month, per week, he will need 120,000 per week. What's the minimum wage? It's 30,000, Abi. Okay. So in a year, 6.4 million. On dialysis alone, no, it has no drug. On dialysis in a year, 6.4 4 million to do dialysis. And if you want to go and do transplant, between 11 to 21 million. These are not diseases of a poor person. Unfortunately, the disease catch anybody. Doesn't know whether you are rich or poor. That is the problem. So, we need to take caution to ensure, and also be begging Allah. Because those caution too, we will now beg Allah not to afflict us with any of these diseases. They are not something one should even pray for his enemy. So what are the causes? Diabetes mellitus is the number one all over the world. Causes of chronic kidney disease. So we can see why they are linked. So if you are doing something to prevent hypertension, diabetes, you are in a way preventing kidney disease. Hypertension is the second one. Okay? Chronic glomerulonephritis, obstructive uropathy. Now, Dr. M.I.M. Abi mentioned prostate, especially for us men. When that prostate begins to grow, well, prostate, if it doesn't become cancer, it can still cause problem. When it grows, it will now obstruct the urine passage. So they will say, Baba le to, no le to. You know, it's cancer. It's because it's too big and it has obstructed the passage. So we call that one obstructive uropathy. When that continues, without thing being diagnosed on time, because the urine cannot go forward, what will it do? It will go backward because it is the kidney that are producing that urine. So it cannot go forward, it will go backward. When you go backward, you go and damage the kidney. So it can cause renal failure. For women, fibroid, when the fibroid becomes bigger and bigger and bigger and they didn't do anything about it, it will obstruct the ureters, the both ureters. And if urine cannot go forward, it will go backward. So those are the things. Of course, HIV, hepatitis, sickle cell diseases are diseases that are also common and can cause. So risk factor is the same. If you look at it, it is the same. All these things that we are, especially all the things that they are selling in the joint, and the herbal medications, all sorts of things, they are the ones that are fueling a lot of chronic kidney disease in our own environment. So the symptoms, signs and symptoms from functions. So if it's the one that is helping us to produce urine, the person will not urinate very well. So we call oliguria. Because it's the one that is helping us to control excess water. Then the person will be retaining water. Leg swelling, facial swelling, abdominal swelling. Water will be accumulating. Because it's the same. Okay. So it helps to produce blood. Shame you understand. The person will be getting tired. Many of my patients, they come so late. They come so late because they will be treating malaria and typhoid. Malaria and typhoid because they are getting tired every time. So they will be thinking it's malaria and typhoid, but it's chronic kidney disease. By the time they come, they will be needing dialysis. It's already too late. So now treatment. Well, apart from treating the underlying causes, hypertension, diabetes, when it involves dialysis you have to give, it's expensive. Unfortunately, a lot of patients cannot afford more than 2 or 3 sections. By the time they have done like 10 sections, they have finished all the money in the family, and they have stored this and that, and at the end of the day, patient will die. It's very unfortunate because we would have already impoverished everybody, and then will die. Renal transplant offers a better and a qualitative life, and a quality of life. But it's too expensive. We are talking about 21 million, 30 million. Where is the money? Where the minimum wage is 30,000. So that's the problem. A lot of patients will die. So, now, I said I'm going to talk about preventions. So there's what we call primordial prevention. So all the preventive measures, like good diet that is low of salt, a lot of fruit, natural, okay? Not the synthetic, not the sweeteners, natural. A lot of high fiber diet. Dr. M.I.M. Abiba has mentioned them. And balanced. These are good dietary. Low fat. No cholesterol. These are good diets. So, we will do that. Exercise. Exercise. Allah subhanahu wa ta'ala enjoyed us to do that. So when we are doing it, even when you have not given birth, all of this you do it. It's primordial. If a woman, even before getting pregnant, married, is doing it, if a man is doing it, it will have effect on the unborn baby. So that is preventing diabetes, preventing hypertension for the unborn baby. Now, when a person is now born, he has not got hypertension because he says it's with age. Because what we are eating in the house is what we're doing. If we are using low salt, that is what everybody will eat. Okay? All these things, the children too will learn to take them. Right? And that is primary because the bad no hypertension. But when hypertension has now come, then it becomes secondary prevention. Because all that it will not stop. Even if eventually we become hypertensive, we will not stop doing those things. Why? You want to prevent complication. Somebody can have hypertension like that, Baba, 80 something, and has no complication. It's the complication we want to prevent. So when you are doing and you are emphasizing on those things, we are doing secondary prevention. That hypertension is there, but I want to prevent complications of hypertension. That's secondary. Now, what about tertiary prevention? Now, for any reason, the person now got stroke. That complication has come. Do you want the second stroke to come? People do have second stroke. So it's not the end that, he has stroke, so he should relax. Another stroke can come. That first stroke, he was lucky, he didn't die. Most stroke kills. Okay, so I think that is some of the things we need to do. So when we talk about prevention, eating moderately, reduce cholesterol, avoid frying things every time. It's not every time you will be frying. Imam has already mentioned about eateries, fast food, protein diet, especially those who already have evidence of chronic kidney disease. Maybe by looking to their urine, if there's a protein in the urine, that's an evidence of kidney disease. Reduce protein diet, avoid Maggi, Ajinomoto, because they're all sodium and their families, monosodium glutamate. Even if you are going to use it, very small quantity. So weight reduction, very important. Regular exercise, at least every day, 6 days per week. It has a lot of benefit. I'm not going to read this. There are plenty. All right. So all this one, some people they will say they cannot do without drinking Coke. They are addicted. So let us counsel them. We should counsel them. If at all, maybe on Eid the dying, that we just want to show that no, today is different. No, sincerely, those are the only time we should be drinking those. Let us drink water. And when we start drinking water, we find out that these are not sweet. Water is sweet. Yes. So, a lot of fruits, fresh fruits, let us, drug abuse. So, all of that. So, in conclusion, hypertension, diabetes, chronic kidney disease are common, very common now. They have dire consequences, poor outcome. A lot of people will die, even after spending a lot of money. So, prevention is better than cure. So, but those who have mild, moderate, they should, make sure it is controlled. If they are not controlled, that's when the problem is there. So prevention is always better than cure. Jazakallah khairan.
Takbir, Allahu Akbar. I'm sure we have all learned how to prevent some of these chronic diseases. May Allah enrich our doctor in knowledge. Jazakumullahu khairan.